We are live. Hello, folks. Welcome to ACAP, Winston-Salem's chapter. I'm going to put in our chat. Hold on just a moment. Let me grab that. Copy and paste important information. Wonderful. So hit send. So now there is information in our chat to all of you, our guests, about how to stay up to date on all the ACAP Winston-Salem updates by subscribing to our email newsletter. So if you've not already done that, if you found us through other means, great. Glad you're here. If you want to continue to be in touch with us and us to be in touch with you, we would love that to let you know when we're having meetings like this, virtual when necessary. We are all trying to go live, so I'm excited about that. We'll talk a little bit more about that in just a bit. And we have an online public Facebook group where we share community and support fellow ACAP members. So there are two hyperlinks in the chat. Please avail yourselves of both of those. If you're viewing the presentation on YouTube, you can participate in live chat. You can go there now, acapcommunity.org, acapcommunity.org, find the YouTube section and click on live chat. And that way you can do a couple of things that we would love. Love for you to tell us where you're from. So put that in the chat, please. And then if you have questions along the way, while our presenter is speaking tonight, I will be watching those, monitoring the questions, and so I'll wave my hand to Monique, and we will stop her and let her answer your questions. So, let me tell you about ACAP. For those that don't know, and many of you are returning guests, we're always glad to have you all. So, ACAP stands for Adult Children of Aging Parents. It started out of Hickory, North Carolina, and it's now a collaboration of local chapters. I'm thrilled to announce by the end of this year, we started with one chapter. Winston-Salem was the third national chapter. And by the end of this year, we should expect 7 chapters across 3 states, North Carolina, Pennsylvania, and Georgia. Monique, can I do a sound check? I feel like I hear me echoing. Do you hear me echoing, or is it just my feedback?
I think it's just your feedback. I don't hear it.
Excellent. Okay. So, we're local chapters. We meet locally. Obviously, we're virtual because of COVID, but most all of the chapters are expected as safely as we can to begin meeting again, if not this month, next month, and we will follow very cautious guidelines, social distancing, masking, but people have said they really want to get together, and we do too, but we want to keep your loved ones safe, most importantly. So as we grow nationally, we offer educational programs each month. Some of our chapters will do live and hybrid, some chapters just live, so check with each chapter. Again, acapcommunity.org is the website nationally, and you can find chapter pages and all detailed information from that one stop. But we are here for you. We love your parents, we love our elders and respect them, but we want to help you, the adult child who is helping their aging parent, navigate the complex world sometimes of health and housing options and services. You don't have to be an adult child. You can be a brother, sister, cousin, nephew, paid caregiver. The information is free, and we think it's very good, so we're happy to present that. Let's see, what else do I need to let you know? We've talked about that. If you've missed a talk or want to see it again, we have podcasts and videos on the website, housed on the website, so please avail yourselves of those. There's some really good information. I highly recommend one by Alyssa Botte, B-O-T-T-E, one of our podcasts, and she talked about sibling dynamics. Anybody got dynamics out there amongst your families? Brothers and sisters don't agree on how to care for mama. Mama may not agree. And so she is a counselor and a chaplain and wonderful speaker. And she's got a great podcast on how to navigate those issues for best resolution. So Let's see. If there's not a chapter in your area, we would love to hear from you. We'd love to hear that you're interested in starting one. And so we'll help you to do that. If you put your name on our email list, we very much respect your privacy. We're not going to give, sell, loan, barter those lists. Nobody's going to get your information from us. So we're very respectful of that. Let me move now to introducing the lady you see to, I guess, your left, depending on the way the screen's mirrored. This is Monique Mumford, and I'm delighted to have her here with us. Monique works with a clinic here in Winston-Salem with Novant Healthcare, the Memory Care Clinic, and it is a gift to our community, so you're going to learn some about that. The topic tonight that she's going to cover is not all memory disorders are created equal. To this day, we still got to get a lot of misunderstanding. Is it Alzheimer's? Oh, mom's got Alzheimer's, not dementia, vice versa. So she's going to break down Alzheimer's and other dementias. And of course, whether it's Alzheimer's or another dementia, it's impacting 5 million American families from the research at AARP. And it's sadly a leading cause of death among aging persons. So people are living longer, and the baby boom population ages, and the number of adults and their adult children are significantly affected, not only emotionally and physically with the task of providing care, but the cost as well. So there's a lot to navigate. And a diagnosis of dementia can certainly be overwhelming, not only to the patient, but to the family, the adult child, you. So we want you to know the facts. We want you to know the symptoms, how assessments are done and diagnoses are reached, and what those diagnoses mean to you working as part of the care team with the clinicians like Monique to provide best care for your loved one. We're going to talk about, or she's going to talk about the clinical stages of how diseases progress, what to expect, what's normal, what's not. Emerging research, there's always stuff coming out. There's a couple of questions about that. Current medical treatments and non-medical caregiving options. So we want you to walk away from tonight really having a good sense of what's out there in the world of dementia and specifically Alzheimer's. So let me tell you a little bit specifically about Monique. She has a history of 16 years in the hospital setting as a registered nurse. So I suspect Monique's seen it all. Correct, Monique? Nothing you've seen in the hospital.
Yes.
But not too long ago, she went back and God bless her, she's got her bachelor's in nursing, and she went back and got her master's of nursing, both at Winston-Salem State University here in Winston. Produces a fine nursing program, and I particularly love the NP program. She said, so after her degree, she became licensed as a family nurse practitioner. And so now she works at the memory counseling program. If you're here locally, it's in Kimmel Park in Winston-Salem in the Novant Neurosciences and Spine Center. So please avail yourself of what they can do for your family if you have that need. And we're just about on time. So Monique, let me do a couple of introductions. People are signing in. Thank you. We're delighted. Susan Stafford, thank you for signing in. Harriet, hello. There's an echo, says Harriet. I'm going to turn down my mic a little bit. Hope that's helping. Harriet's still saying echo. Okay. Harriet, is that any better? Hopefully less echo. May have had the volume too loud. So sorry for that. Yes, please, again, if you're on YouTube, like Susan and Harriet, sign in. That's about the best I think I can do. I may play with some audio settings and try not to interrupt Monique, but we will take off from there then. Monique, the show is yours, my dear. Thank you so much for taking the time tonight. We appreciate you.
Thank you, Bob. Thank you for that warm introduction. Excuse me. Hello, everyone. Good evening. Thank you so much for joining us tonight as we discuss memory disorders, and in particular, Alzheimer's disease. Alzheimer's, so a lot of times you hear people say, I have dementia, or my loved one has dementia, and it's not Alzheimer's. I think many years ago, because didn't know what exactly Alzheimer's disease was, they grouped every memory disorder under dementia, which is kind of similar to what we still do. However, with research and new medical advances, we are now able to tell someone if they have Alzheimer's disease or if they have Lewy body dementia, if they have frontal temporal dementia, if they have vascular dementia. There are several types of dementia, and it's important to know what you have and how can we treat it? What are we doing today? And exactly what is Alzheimer's? It's a disease that affects your brain, and more importantly, it affects your memory. And I tell patients every day, here's how you can tell the difference, because what you'll hear is a lot of people will say, I have memory loss, but I'm getting older. And that is true. As we all get older, we don't remember like we used to, and that is completely normal. It is not normal when you forget to do daily activities and things that you should know how to do, like drive a car or something as simple as cook a meal or put your clothes on the right way. That's when it becomes a more serious memory problem. And then you end up, you tell your doctor, or you might mention it to your doctor or a loved one. And sometimes your loved one might notice these changes and they think, well, something's not quite right. This is a little bit more serious than just, mama or daddy getting older. It is really about completing day-to-day tasks. Like I said, like driving a car or preparing a meal or, again, putting your clothes on. Not something as simple as forgetting where you placed your keys or forgetting a name of a person that you don't really interact with every day or every month. That can sometimes be concerning for Alzheimer's as well, but it's more when you combine that memory loss with difficulty completing your day-to-day tasks. And you end up at a place like a memory care center or maybe at your doctor's office, and they perform an assessment. What we do in my clinic is the MOCA exam. It's a Montreal Cognitive Assessment. It's not a diagnostic tool. It is a screening tool. And it's pretty accurate, though. It's about 97% accurate in helping clinicians determine if a patient has Alzheimer's or not. And we score it. And based on the score, we're able to determine if the person needs more assessment or if we can safely settle on a diagnosis of Alzheimer's. We also like to rule out things before we tell someone, you have a serious memory concern or an issue like Alzheimer's. So we try to rule out things. There are lots and lots of things that can affect one's memory. Your medical history is taken into an account. We also will check some labs. There are some particular labs that will affect your memory. So we like to make sure that those things are normal. We also take a look at your brain with a scan. We may do an MRI or a head CT to rule out any other causes like a stroke or a brain mass or a tumor or any other process that could be affecting your memory. And believe it or not, you may or may not know this, but hearing loss can also affect your memory. If you don't hear what people are saying, it sometimes will mimic memory loss. So we ask you a bunch of questions about your medical history, things that might be going on with you, and try to rule out, again, all the things that could affect your memory. So when we can safely rule out medical reasons, then we go to psychiatric illness. Depression, stress, or anxiety All of those things can also affect your memory. So we ask you about your social history. Has there been anything new that happened? Sometimes family members will move older loved ones closer to them because they see them struggling in certain areas, or they just want to have them closer so they can help out. Sometimes that move, it sounds good on paper, but sometimes that move can trigger some memory issues. And those issues are usually there before, and maybe your family just didn't pay any attention. Number one, because they weren't around you every day. Or number two, they just, complete your day-to-day task or help you with those things just out of habit. I see that a lot with husbands and wives, especially. If a husband is forgetting, where he put his keys, or a wife is having difficulty with cooking her favorite recipe. Sometimes families will just go in and help, just again out of habit, and not really pay those things much attention until something major happens, like a big stressful event or a big move, or sometimes you can have a death in the family. So different things like that will trigger these memory issues, and then everybody notices it. And even sometimes it's rare, but sometimes patients even notice that they're having some memory issues. And it depends on where you are in the illness, if you will be able to recognize that this is truly something a little more serious than normal age processing. And so I encourage you all, if you notice that with your family members, just subtle changes, get them checked out, because it could be something related to their medical issues. It could be depression. It could be psychiatric illness like anxiety, or it truly could be that they are in the early stages of Alzheimer's. So remember in the beginning, I said we used to just lump everything under one big umbrella. And I'd still do that sometimes just for conversation purposes to help people understand. Dementia is the big umbrella. And underneath dementia, we have several different types of dementia. The most common is Alzheimer's. And as Bob stated earlier, it affects over 5 million people. And that number, I am almost positive, is going to continue to rise because people are living longer. And so we're going to see more and more people affected. What we don't know yet is why it affects some people and why some people are not affected. There is some research currently underway. They are doing gene testing, and some people have the gene, some people don't. There are some theories, I guess, for lack of a better word, on why some people develop Alzheimer's and some people do not. You can have it in multiple generations, and then you can have, your loved one who never had anybody else in their family that had memory problems. I hear that just about every day. Patients will tell me, well, my mom lived to be, 98 and she was sharp, or my dad, he was 95 and he never had any memory problems. Why is this affecting me? That's the thing we don't know yet. We're still learning about it. Even many, many years later, we're still trying to figure out why some people get affected and some people do not. But it is difficult for clinicians to diagnose Alzheimer's because, again, it can look like a lot of things. It can look just like hearing loss. It can look just like memory loss, stress, anxiety, depression, all those things. If you have a vitamin B12 deficiency, if your thyroid is underactive or overactive, all of those things. If you've had a stroke in the past, all of those things can affect your memory. So what's important is that we take care of ourselves and make sure your loved one is getting to the doctor for those regular checkups. Even if they don't take any medicines, it is important to see your family doctor at least once a year. And if you have some chronic medical conditions like diabetes or high blood pressure or high cholesterol, it is important that you see your family doctor. Make sure that those numbers are good. And if you need medications, take them, because those things also over time will affect your memory. And we see it when we do those brain scans, such as an MRI or a head CT. We'll see those vascular changes on your imaging. And a lot of times patients will say, well, I didn't know I had high blood pressure. And that is true. Sometimes it can go undetected. It is one of the number one killers as well, silent killers, hypertension. So go to your family doctor, encourage your loved one to at least see their family doctor at least once a year. And that way we can try to prevent some things from causing further damage. We can't prevent Alzheimer's from happening, but if we can catch it in the early stages, there are treatments that are available. There are certain medications that we can prescribe to help delay decline. Unfortunately, there's not a cure for Alzheimer's, but the medicines that are out there are pretty, helpful for some. I will say that the research will tell you also, and if you do the research and read the literature, it will tell you that those medications have very modest benefit. But for some people, that modest benefit is worth $1 million. And then I have some patients who will tell me, well, if it's not going to really help and not really improve my memory or stop my memory loss, then I don't want to take it because of some of the side effects. And as we get older, our kidneys slow down, our liver slows down, and we hold on to medicines a lot longer. And so clinicians are very careful in prescribing medications for the older population for those reasons. And when you hold on to medicines, it increases the amount of the medication in your blood flow, and that can cause some dizziness. It can cause some low blood pressure, low heart rate. It can increase the behaviors that come along with Alzheimer's. Sometimes if patients were not having any issues like hallucinating or agitation, sometimes that medicine can increase those things. So we are very, very careful before prescribing those medications. It's on an individual basis. For some people, it will work wonderful. And then there are other people where it just won't have any benefit and it will cause harm. And so we are in the business of not causing harm. We're in the business of saving lives and helping people to feel better and live their best life as best we can. So talk to your clinician, talk to your family doctor about different treatments that may be available for your loved one. Again, every medicine is it's not going to work for your loved one. And so I know a lot of times we talk amongst each other, amongst family, amongst friends about, well, what is your loved one taking? And it seemed to help them a whole lot. And I hear that every day too. And so what we have to do is take the medical history into consideration before we just start prescribing medications. The best treatments, believe it or not, do not even require medicines. The best treatment, and that is for just anyone, whether you have a memory impairment or not. The best medication is no medication. These are things that you can do on your own that will help improve your brain function and help to slow down memory loss. And it's physical activity. If you're not exercising, make sure you're out moving, even just taking a walk up and down your driveway, checking the mail or walking around your home. Encourage your loved one to do that. Just move their body. The other thing we encourage our patients to do is socialize. We are still in a pandemic, so we get it. People are not getting out like they used to. Some people are not even going to church. We get it. We understand that. So as much as you can, as safely as you can, make sure you're being socially active. And then the last thing we encourage our patients to do is stimulate the brain. So that means not sitting around looking at the news all day, not sitting around watching television, but actually stimulating your brain by pushing it outside of its comfort zone, doing some type of puzzles or games. You can read. Reading is very good for stimulating the brain. Looking at magazines. Some people read the newspaper every day. And some people are really still good with the computer or as tablets or smartphones. So if your family member can still use a computer or their smartphone or tablet, download some brain games. There are tons and tons of games out there that they can do. I always tell people, don't just do a game because I told you it's good for you, because you're not going to continue to do it. You got to find something that you enjoy. So if it's not puzzles, then don't do puzzles. If you don't like doing Sudoku, don't do it. If you like word search, do that. If you don't like word search, don't do it. You got to find what you love. And because it's so many different games, I just encourage people to keep trying. Find one that your loved one likes and you do it with them. It will be beneficial for both of you. Find one that you like and find one that they like and just do it every day. The best thing is not creating stressful situations for someone who has a cognitive impairment like Alzheimer's, because earlier, remember I said stress can contribute to memory loss. So if your loved one has a memory impairment like Alzheimer's, the last thing you want to do is stress them out, because you're going to have a battle and that you're not going to win. So it's not fun. I see it every day. And if you are caring for a loved one with Alzheimer's, you can probably attest to that. Sometimes you got to pick your battles. You're not going to win, and it's okay. It's not about winning or losing. What we focus on is symptom management and supportive care. So we support our loved ones when they can't remember or complete the task that they're having difficulty with. We help them out. We do gentle reminders. Sometimes it requires you to set medications out that they may forget to take. Sometimes it requires you to spend a little more time by taking them to the grocery store if they're getting lost. Sometimes it requires having difficult and uncomfortable conversations with your loved one and with your family members, because we don't encourage our patients to drive. We don't want them doing their own medicines, and we don't want them to manage their own finances. We are not trying to take away their independence, but we want to ensure their safety. And when you can no longer ensure their safety, then we have to have a different conversation. So I encourage patients and family members to have difficult and uncomfortable conversations early on about what the plan is, what the future looks like, what would you like to see happen? Because what you don't want is for you to have to come in and make those decisions for them and remove them from their home or take their keys, things like that. And believe it or not, you really don't have a legal foot to do that if you are not their legal guardian. If you do not have legal guardianship, being the healthcare power of attorney is something totally different than being someone's legal guardian. And so I have heard patients who insist on driving report their loved ones for stealing their car. It happens every day. So again, that just requires a conversation for you guys to start having with your loved ones about what the future looks like, what can we help you with, and how can we ensure that you are safe, because that is the ultimate goal, is ensuring a patient's safety, whether that be extra support in the home or moving to a facility where they can have that extra support, because patients, their families work, and we get it. You don't want to stop your life because you have to care for your loved one. So we want you to have these conversations, talk about it, and come up with a plan as a family. I like to give patients the lead, especially when they can still have that lead. There are going to be some times when the disease is too far advanced and the patients cannot make those legal decisions or good judgment decisions for themselves, and family members have to take over. But early on, if you start recognizing the signs, again, it is difficulty completing tasks, day-to-day tasks, simple things like driving a car. If you notice your loved ones calling you, multiple times a day, asking you the same questions, it's time to start getting those things checked out. If you notice your loved one is having difficulty going to the grocery store that they've been to many, many times, and all of a sudden they couldn't remember how to get there or couldn't remember how to get home. Or if your mom or dad made a pound cake for 40 years and all of a sudden can't remember if eggs go in that pound cake. Those are signs that this could be a more serious memory concern. And those are the things that you want to have checked out. So staying involved and, just staying on top of things, encouraging them to, again, visit their family doctors at least once a year. And just you staying involved in their care is going to be the most beneficial for your loved one, especially if they have Alzheimer's disease. Again, it is a progressive disease. It does get worse. There are 7 stages of Alzheimer's. In the beginning, most people, again, just fly under the radar. They just tend to have some memory lapses. They may forget where they place their keys, or you walk into a room. Sometimes you might forget what you went in the room to do, or you may have difficulty recalling words, or you may forget what someone just told you 5 minutes ago. I hear that a lot. And so early on, those are the early signs that this could be Alzheimer's. As it progresses, patients start having difficulty with functioning, and that is dressing themselves, feeding themselves, urinating, going to the bathroom. Sometimes patients will use the bathroom in odd places. They might have difficulty cleaning themselves. Sometimes they get scared and stop bathing. So you just got to, again, stay involved, try to pay attention to those subtle cues. Sometimes it could be that it's more serious, like Alzheimer's, and sometimes it could be something simple like a urinary tract infection or a medical condition like a thyroid issue or B12, or, maybe they're stressed, or maybe they are anxious, or maybe they have a little bit of depression. Maybe their loved one just passed away and they're having a hard time dealing with that. And older people, they get lonely because their friends are, passing away, and their daughters and sons, they feel like are very busy and don't have time for them. I hear those things a lot. So again, staying involved in your loved one's care and recognizing those early signs of something more serious like Alzheimer's is going to be the most beneficial for you getting your loved one the care and support that they need. And don't be afraid. I heard this today. A patient said he was embarrassed. He didn't go out much now because, they're embarrassed. They feel like when people ask them questions, they may say the wrong thing, or they may not remember what they need to say. So I encourage him to let people know there are going to be more people that are willing to help you than not. And if you let people know, then they can support you. But you can't support someone if they don't know, So it's not something that you want to try and figure out by yourself, because it's going to take a team of support. It's going to take a lot of patience, and just equip yourself with the knowledge. And that comes from just talking to other people. You'll be surprised that there are many, many people in the same situation as yourself. So again, encouraging everyone to stay involved in your loved one's life as we all get older. We need extra support, and we need to make sure that our loved one is safe. That's our goal. We focus on symptom management and supportive care, and always at the top of our priority list should be safety. So and you have to ask yourself this, if you can no longer ensure that your mom or dad or grandmother or aunt, uncle, cousin, whoever it is, if you can no longer ensure their safety, then you have to have some difficult and uncomfortable conversations about what their future looks like and what it looks like for you too. I've said a lot, and I know it's a lot to take in. Do we have any questions about anything I've said so far?
Yeah, encourage, yes, please type those in the chat box. Couple of things have come up, and I like the kind of general overview. Appreciate that. I'm thinking about that river in Egypt denial that exists in many of our families.
Yeah.
Right? Oh, mama's being frustrating. There's nothing wrong with her other than being frustrating. And oh well, maybe she gets depressed, but every old person gets depressed, and there's nothing you can do. Can you dig a little bit down from the clinical side, addressing those sorts? Because I know I hear a lot of that in the community.
Oh, absolutely. I think if I had a nickel for every time I heard, oh, I'm just getting old, or, it's fine, everybody forgets, or it's old age, nothing wrong with me, I think I could probably retire now. And the truth of the matter is we do tend to forget. There are some things that are normal for the aging process. Again, when your loved one has a difficult time completing tasks that they've done for many, many years, things that they should know how to do. If you made that pound cake for 30 or 40 years, you should know that it takes 6 eggs or whatever, right? And when mama gets frustrated and can't remember that, that is a sign that this is a more serious problem. It's not just getting older. Mama and dad will get frustrated because you are bringing it to their attention. No one wants to hear, I might have Alzheimer's. So again, learning the lingo, learning the language. How do you address your situation? How do you approach your loved one when you want to bring up your concerns? And I tell you to do it very gently, because you will get some pushback. Remember, I said it's a battle and you will not win. And unless you have legal guardianship over your loved one, legally, there's not a whole lot that you can do. And it sounds really harsh, but it's a harsh reality that we have to deal with. So early on, just have those conversations with your parents, with your loved ones, before it gets to the point where they're frustrated because you keep bringing up their memory issue. Mm-hmm. That is, and if you think about it, think about yourself. If you had a deficit or if you struggled with something, you wouldn't want to hear about it every day. It will frustrate you too. Mm-hmm. If someone constantly brought up, if you're dyslexic or something, and someone constantly brings that to your attention, mm-hmm. is going to, number one, make you kind of self-conscious about it, yeah, and withdrawn. And then you're not going to talk. You're not going to be around your loved one. They're going to push you away. So you don't want that. Remember, you don't want to create stressful situations. Sometimes it's better to go with the flow rather than trying to fight that. Yeah. There's a way that you can gently approach these conversations. And so I encourage you to do the research, number one. Figure out what it is that your loved one is struggling with. Mm-hmm. Is it truly a difficulty completing a task, or are they stressed out? Because there are some patients who are caregivers for their adult children or for their spouse, which can cause some memory issues. Remember, I said there are a lot of things that can affect your memory. So you got to sometimes take a step back, assess the situation, see what's really going on. Is your mom taking care of your dad who's critically ill? Has your dad been in the hospital? Has your mom, been sick for many, many years and dad is just frustrated because there's nothing he can do about it? Again, that takes you getting involved in your loved one's care and learning how to gently approach their memory concern or your concern, really, because a lot of times, remember, patients won't even realize that there's something going on. We hear it a lot. There's nothing wrong. I'm getting old. You don't remember things. You forgot. They love to say what the other person don't remember either. And it's true because we all forget from time to time, right? So trying to just pause, take a step back, try to figure out what else could be going on. Not to diminish your concern, but figuring out a way to approach it so that you don't push them away, because you kind of know that this is more serious, but you don't want to push them away. You want to get them into a memory care, clinic, or you want to get them to their doctor's office. Sometimes that takes sending a message to the provider and expressing your concern that they mention it or test them when they come back in for their physical exam or for their 6-month follow-up. Sending messages like that, or again, gently approaching it. Just, nobody wants to hear, you did this or you did that, or you can't remember this. And, and we see that, and that creates stress, and it's going to cause your loved one to shut down. They're not going to share their concerns with you. They're not going to open up to you. And every time you try to go over for dinner, they're going to say they're busy or they're sick or they don't feel well. And that's them shutting down and shutting you out. And that's the last thing you want to do. So learning new ways to approach when these situations come up, reaching out to therapists or social workers who are experts in caring for patients with dementia, or for caregivers who are taking care of their loved ones with dementia. So reaching out to the specialist and figuring out what words can I say that won't trigger them. How can I approach the situation so that I don't trigger them, and I'm opening up the door for us to have a true, candid conversation.
And I like
pushing them away.
I like your segue when you're talking about communicating with the provider. You said send a message. I've seen it backfire where the frustrated daughter's got mom in the clinic, and boy, she can't wait to unload. Well, I think mama blah 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 blah. Well, oh gosh, disaster. Send a message ahead of time, a confidential message to the provider. Hey, we're coming in. This is my mother. Here's what I'm seeing. Here's why I'm concerned. Can you gently explore that, please? And please know that she's mad at me about even thinking it.
Correct.
Do you get those kind of notes as a provider ahead of time?
Oh, absolutely. And they're very helpful because, again, I don't want to push the patient away. I want to help them. I want to support them in this journey. Most of the time, clinicians and family, we know that it's a more serious issue like Alzheimer's, but we can't reach you if you're not coming to see us. And so the last thing I want to do is push you away by telling you, well, your daughter said or your son said, X, Y, and Z. That's not how we approach it. There are some things that we don't even mention in the visit. Number one, patients are not able to mentally accept that. And if you are so adamant that you do not have a memory problem, you are not going to hear one word that I say. And you're going to be angry at not only the person that brought you here to this visit, you're going to be angry at me, and you're never going to come back. And that's one person that we missed And that's one more person on the streets that is driving that puts everybody at risk. So we don't want that. We try to capture them while we have them in our clinic. So sending messages, private messages. I have patients who type up dissertations.
Yes.
Do it. We will read it. I promise you. There are certain things that we just don't want to mention in the visit because it's going to trigger them. I've had patients get up and walk out because, we mentioned the word Alzheimer's. So, and sometimes we don't know that. Sometimes we just can't avoid it. I tend to be direct, but I have a gentle approach. I don't like to sugarcoat things because I'm a provider and I try to do things professionally and give you the medical advice and the expertise, but also keeping in mind that I do want to help you. I don't want to push you away. So if there are certain things that I know is causing some great tension between you and your loved one, and your loved one is sitting there giving me the side eye, like, don't you say it, I'm not going to say it. Because at the end of the day, you've got to go home with your loved one. You've got to deal with them. So I don't want to create a stressful situation for you or an unsafe. And that has happened too. There are times patients get so angry and they, threaten to harm themselves. They threaten to harm their family members. So at the end of the day, again, safety is our priority, and just finding gentle ways to approach those conversations. So yes, send a message, type up a whole paper, send it to your provider. If your loved one is so advanced that they're not on my chart, or I don't know what the Baptist system is, if they're not able to get into that, perfect. Send a message through my chart because they're never going to see it. But if they are still capable of logging onto my chart and reading their messages, don't do that. That has backfired too. So send something privately, or ask to speak to the provider privately before the meeting or after the meeting. I've had that happen. The loved one will, be sent out to the waiting room, and the patient's family member will say, I've got to use the restroom. I'll be right back. There are ways that you can voice your concern without causing a fight between you and your loved one. Because that's not what you want.
But one of the things that you guys have as specialists, and one of my questions is, when is it time for the adult child, the caregiver, the family caregiver, to go, you know what, here's my sign. May love the family doc. You've mentioned using the family doc a lot, and they can do some things. But I sadly, I see a lot of family docs who do a MOCA or a clock test, or the MOCA, and including the clock test. And it's like, oh, we're just going to file that. And it's like, well, wait a second. When do you stop just filing it and watching it? And when do you and when do you, as a caregiver, say, I think I need to take the next step to a specialist?
When you feel like, so a lot of times the MOCA, again, is not a diagnostic tool. It's an assessment. And you're right. A lot of family docs will do it. If it's normal, they'll file it away. But if you are persistent and you insist that this needs to be investigated further, ask them to refer you to a memory care specialist. Some doctors are comfortable treating Alzheimer's, and they are certainly capable of that. If they are not, that's when you have to just speak up and say, can you send me somewhere where, I may be able to get some treatment? The difference in memory care and family docs is simply time.
Yes.
And we have the specialists like a social worker. A lot of clinics, I'm not sure if they do or don't. I really don't know that answer, but I would imagine that they can get you in touch with someone who can help you. I know our clinic specifically, we have the neuropsychologist who do the more formal memory tests,
Right.
and we have the social workers. So that's a bonus for us.
It is.
But the difference in what I do and what a family doctor will do is simply time. So if your family doctor is comfortable prescribing those medications, and able to see you back, every 3 to 6 months, which most doctors do, then it's fine. If they're not comfortable doing that, or you see your loved one is progressing and you want to know, is there something else they can do? Most doctors don't hesitate to say, I'm going to send you over to memory care.
Yeah.
And that's when we have, the conversations about what are the next steps? What do you want to do? And truthfully, family doctors only have 15 minutes.
Yep.
So it's really, really difficult for them to spend that time with you and address your concerns, and make sure that you get all the information that you need in 15 minutes. It's really about time. That's the difference.
Well said.
Yeah.
And, one of the tools you guys have, and obviously the family docs have the MOCA, and I'm a big fan of that subsection, the clock test. I have had the privilege of sitting in clinics with a patient getting an early diagnosis and watched them do the clock test. And it's astonishing that tool, the physician doesn't have to say anything per se. You can see the dawning of, I should be able to do that, but I can't, and I can't find the tool in my head to do it. That just opens up such a door for you guys. But then that's what takes the time. Hey, can we talk about this? Did you have difficulty with that? Tell me what you were thinking.
Right. Yeah.
And I love that.
The family doctor will look at it or file it, and they just look at that bottom line. They do document it, because I do see the notes where they document exactly what they did on the MOCA. And then they do refer them to specialists like the memory care clinic. But it really boils down to time, what we have time to discuss, and do we need to further investigate this? Which, that's what we do at my clinic. We can further investigate it with neuropsychology. Family doctors can also send patients for that. It doesn't have to be at a specialty clinic like memory care center. There are neuropsychologists that do those type of testing, and that's where you get your formal diagnosis. It only further confirms what you already suspect. Sometimes it's not necessary. There are some patients or family members who are in denial themselves. I've had family members to say, oh, they're just getting older. But the patient is sitting there going, no, this is not old age. I really have some issues with my memory. So for those type of patients, we send for neuropsych testing so that you can see in black and white that your mom or dad does have a memory issue, like Alzheimer's. So it's very helpful when patients are in denial, or if their family members are in denial that this is truly something more serious like Alzheimer's. Neuropsych testing is helpful for that.
And at that stage, they're the ones who can kind of tease out what type of dementia it is if it's not the predominant Alzheimer's.
Correct. Most of the time, they take into account the medical history, and they have a battery of tests that they administer. And it's really, again, difficult to diagnose the other types of dementia, like the Lewy body, Parkinson's, or the frontotemporal. And it's because patients present different, and it affects everyone different. But there are some key classic signs. And so the neuropsychologist can, based on how they perform on those tests that they administer, they can decipher more so than with the MOCA what type of dementia that we're dealing with.
And to highlight that piece, when we hear testing outside of the clinical world, battery of tests, it's like, oh, we're going to take a bunch of blood or run an electronic probe through mom. It's paper and pencil testing, actually, right? I mean, it's a lot of draw this, copy that.
It's very, very similar to our MOCA, which is questions and recalling words and identifying pictures. The formal memory test with neuropsychology is very similar to that. They ask a bunch of questions. They give you paper and pencil. You're going to be drawing very simple things like shapes, things that you should know how to do. You should know what a circle or a triangle, different things like that. They ask you to read numbers and patterns. And so based on the results of that, that's how they are able to determine if you have a neurodegenerative disorder like Alzheimer's. They are able to plug in your age and your educational background, and they compare that with other people with similar ages and similar educational background. And so based on those examinations and I guess studies, they're able to see that this is what this person should be able to do, because half of America, that's 85, that have a master's degree should be able to do X, Y, and Z. And that's how they come up with the diagnosis. With the MOCA, we can't plug in your age. We can't plug in your educational background. It's a very general assessment, and that is why it is not diagnostic. We take into consideration the medical history. That's more so what we do. You tell us the things that you are having difficulty with, or your loved one can tell us, and that's how we base our diagnosis. It's not just an easy one type deal. You do the MOCA and that's it, you have dementia. It's not like that. We base it on our clinical judgment and your medical history.
Okay. All right. And I love
the pattern that we look at.
Yeah. Is there a value in a family member going, hey, I don't know how to analyze it or interpret it, but Mom, are you concerned about have you ever concerned about your memory? How about every year, just at home, I do the clock test for you? Is there value in that, doing it at home?
Not really. Okay. Because again, so here's the thing, and I think the clock test is it's valuable, but it's so kind of unfair. Okay. Right? When you so not with older patients so much, because my generation and further back, we learned how to draw a clock.
Yeah.
I think that as we continue in this, it's going to be kind of difficult for us to assess your cognitive abilities based on you drawing a clock.
Yeah, the new one's going to be, can you draw an Apple Watch?
Can you draw an Apple Watch? Correct, right? So I think for now, and depending on the age of the patient, and certainly we're talking about 65 and older, they should be able to draw a clock. Is that something you want to do with your mom every year? If you already know that they have Alzheimer's, absolutely not. It's not beneficial.
That's just a frustration.
It does nothing but frustrate them, right? Because they know they cannot draw those numbers.
Right.
I've had patients throw the paper. I've had patients start crying. So, and we don't repeat that MOCA.
Right.
If the number is so low, and based on, again, your clinical assessment, we don't need to further frustrate you. So you say, do you need to do that at home? No, not unless you know how to interpret the results.
Okay.
If you don't know how to interpret the results, you're going to come up with all kinds of things. So I don't think that that's something that any layperson should do. Okay. I think, you should absolutely assess your mom or dad's memory by asking simple questions. Mom, how you doing? Is your mom forgetting to pay bills? Is your mom forgetting to take medicines? Is dad getting lost going to the drugstore, picking up a prescription? Okay. Did he get lost? Did he just stand there at the gas pump and not remember what to do?
Right.
Simple things like that, day-to-day tasks, not so much testing, because if you don't know how to interpret the results, is not going to be helpful. And then also, if you have a diagnosis of Alzheimer's, and you ask a patient to draw a clock, you're just going to create some more frustration.
Yeah. That makes sense.
So checking in, absolutely. Check in, make sure things are going well. Make sure there's nothing that seems awkward or, something out of place. Check your mom's bank statements. Make sure she's not giving $500 away to those spam callers. That happens.
Yes.
Make sure I had one lady just withdraw $500 every day for a week and didn't know where the money was. So that's how her daughter finally caught on. She happened to check the bank statement one day, but by then her mom had withdrawn $2,000 and couldn't account for it. So check in. Make sure you're on your mom and dad's banking account. Make sure that you are looking at their pill bottles every time you come over. Patients will tell you, yes, I take my medicines, but they don't. You go and check the pill bottles and it's full. Or I had one lady, her pill bottle was empty and it should have not been. She took all of her medicines for the entire month in about 2 weeks. Or I don't know if she took them or she threw them. We don't know. So that's why you got to be involved. You got to, make sure that your mom and dad is getting those refills. Your mom and dad, if they have Alzheimer's, they're going to tell you every single time, yes, I take my medicines. Or yes, I get my refills. And then when you finally get involved because something tragic, God forbid, has happened or something major has happened or your mom was found wandering in the neighborhood or on the side of the road in Virginia, and you go and look at the pill bottles and they haven't been filled for 3 or 4 months. So if you have any kind of inkling, get involved. Get involved.
Speaking of pills, and you touched on a couple of things that just make me happy in the world of gerontology, geriatrics. Get involved, be gentle, don't confront, work with your doctors, good communication. Deprescribing, audiologist. I think audiologists and pharmacists are way too left out of so many of our conversations about loved ones. So best place to start with, hey, let's do a review of the meds, because particularly if mom's got 5 providers, you only know what you're giving her, right? But maybe she's seeing 2 other docs. You like the idea of going to a pharmacist and saying, take a look at all my package? And then that pharmacist, I guess, can contact you to discuss.
So they generally do med reconciliation at your family doctor. A lot of times, like you said, the specialist will only know what you're giving them. Novant has a system in place where we are supposed to, as a provider, do med reconciliation at every visit. Does it happen at every visit? No, it doesn't. So it is important, again, to, when you see your family doctor once a year, or every 3 months or every 6 months, bring your pill bottles. And if you can't bring your pill bottles, which is the most helpful, bring your pill bottles. If you can't do that, bring a list. Always keep a updated list of your loved one's medications. If they go to the hospital, there's going to be someone before they leave that hospital who's going to look at their medications. They're going to make sure that the home medications have been checked off and signed off. Here's what we want you to continue. Here's what we're going to add new. That's usually on the after visit summary. Make sure you look at it. Make sure you make a copy of it. Because if your loved one has Alzheimer's, guess what? They're not. They're not going to remember. And so when they finally go back to the doctor 6 months later, you don't know what they're taking. And it's very time consuming. And I can only speak to that for me personally, because I don't want to spend 30 minutes going over your medicine. That your mom or dad has no clue, and neither do you, quite frankly, what they take. So it's very frustrating as a clinician to have someone not know what they take. I get it as a layperson because before I was a nurse, I didn't probably care.
Little pink pill.
Right. I knew my mama took a blood pressure medicine. That's all I could tell you.
Yeah.
But being in this game for over 20 years, I can tell you, you better know what you're taking and why you're taking it. And if you don't know, make an appointment with your family doctor. They're going to have to take the time to sit down with you and tell you what you're taking and why you're taking it. It is important. And if you have Alzheimer's, you're not going to know. So that's where your loved ones and caregivers come in. Make sure you know what your mom, dad, grandma, auntie, uncle, cousin, make sure your brother, we have caregivers for brothers and sisters. Make sure you know what they're taking, not just a blood pressure pill.
Yeah.
Know the name.
Yeah.
And if you can't pronounce it, don't worry about it. Have a list. Write it down. That's all we want.
Well, that's a magic wand solution, Monique. I mean, how many problems that would solve in our world? Just what you said.
Yes. Yes, and you should want to know. I hate to say it, but we make mistakes too. Yeah. So it is important for you to become an advocate for yourself and for your loved one. You are their champion. Yeah. Make sure that you know what they're taking and why it is important that they take it. Because it's your life.
Yeah.
And you don't want to put someone else in control of that. That's really the bottom line.
Yeah.
It's important for you as a patient and you as a caregiver to know what you're putting in your body.
Yeah.
It's just that simple. I really can't stress that enough. And I learned it early in my nursing career. Make sure you tell patients what you're giving them and why it is important that you take it. So I encourage all of my patients, no ma'am, no sir, we're not going to say that. Yeah. You're not going to say, I'll take a blood pressure pill. You're going to say, I take a whatever pill for my blood pressure.
Yeah.
And if you can't do it, I'm looking to your daughter or your son or your granddaughter to tell me.
Yeah.
Because that's going to save your life.
Yes.
And it really
I'll tell you anecdotally, I'm a high achiever. Had 2 heart attacks before 50. Ended up on one of the major medications, prescriptions, and was seeing the cardiologist twice a year. Cardiologist changed. I ended up with 3 over 5 years. And the first one in 5 years said, you're not supposed to take this after the first year. Nobody is. I went, looked it up on Google, and it said, nobody's supposed to take this after the first year. If I'd have done that from the get-go, I would have been the one raising my hand going, hey, is it time for me to end this? But I took it 4 years too long. Who needs to put that med in their body when all the research says don't do it for 4 more years?
Exactly. And I prescribe medicines every day. Yeah. But I'm a big proponent on if I don't need this, I don't want to take it.
Yes. Yes.
Yeah. And I feel that way about my patients. Yes, absolutely.
Well,
absolutely.
Thank you very much. Harriet says, thank you, Monique. Great presentation. Very helpful.
Oh, thank you. Thank you.
Much appreciated. That looks like our time. I'm going to do a little bit of wrap up and closing remarks. So as I said at the beginning, if you didn't sign in early, ACAP is a collaboration of local chapters. We'd love for you to get involved. Go to acapcommunity.org, our website, find local chapters, learn more, look for videos and podcasts. And if you'd like to be in contact with us and us with you, we won't overwhelm you, but we'll send you invitations to join these meetings live and virtual. So give us your email and your name and a brief message, and we'll go from there. We'll take it from there. We are particularly grateful. Guess what? Caring or information is universal. Good information. This applies in Germany, right? It applies in England. It applies here. So thank you for good information. But caring is local. And so that's what ACAP is about, is local chapters helping you care for your loved one. but and caring can be, I hate to say it can be free, because even that comes at a cost, right? An emotional, the time cost. But putting things like this on, having access to the technology, and cost a little bit of money. So we want to thank very much our sponsors. We have a chapter sponsor or core sponsor, the Mrs. Norma Charles Sink Fund. And so we're very grateful for their support to make this happen and make this education and other sessions like this free to you. I'm going to put in a plug, and I hope Monique, you'll agree with me. I'm a part of Stick Center's Healthy Brain Research Study. So if you want to help prevent future dementia, get involved in the study. They can take folks who have dementia and folks who don't yet. They need all kinds. So please give them a call. We do hope you'll join us next month for same time, every third Tuesday of the month at 5:30. So Tuesday, August 16th. Actually, this chapter's not going to be doing the broadcast. So we will be live at Highland Presbyterian Church. You've been coming to Knollwood Baptist for 2 years. We've had to change venues. They're wonderful people. We're very gracious, appreciative of Knollwood, but the timing has not worked out. So we just sealed the deal today. We're going to be at Highland Presbyterian in the Ardmore area of Winston-Salem. We would love for you to join us. So 5:30 on August 16th. And there's a timer going on. So thank you very much, Monique. We appreciate your time, your passion about caring for patients and sharing your knowledge. And thank you all who have a good evening.
All right, thank you. Have a good evening.